Okay, so now we will be discussing this very important topic, that is, if a patient of ascites comes to you and the ascites is infected. Okay, so the patient can have any one of these 5 clinical entities. First of all, spontaneous bacterial peritonitis. In spontaneous bacterial peritonitis, we get more than 250 polymorphonuclear leukocytes, that is more than 250 neutrophils in ascites, and along with that the patient's ascites is culture positive for a single bacteria. Okay, for a single bacteria, then it is known as spontaneous bacterial peritonitis. But what if the patient has cells more than 250, that is has neutrophils more than 250, but the culture is negative? In that situation, we call it as culture negative neutrocytic ascites. Okay, and just reverse of it, that is the patient's culture is positive but the cells are less than 250, the neutrophils are less than 250, then we called it as monomicrobial non neutrocytic bacterial ascites. Okay, now another entity, that is if the patient has neutrophils more than 250 but the culture is positive for more than one bacteria, that is polymicrobial. If the culture is positive for polymicrobial, then it is known as secondary bacterial peritonitis. And the last thing, if the culture is positive for polybacteria but the cells are less than 250, okay, the neutrophils are less than 250, then we called it as polymicrobial bacterascites. So this is a very important clinical entity and you should know this. If you are clear with all this definition and if a examiner asks you this, then you are definitely going to top the exam. Okay.